You may think you know how to hold the transducer using your ultrasound machine, but let me give you a few tips that might help you master your MSK scan technique. First, I'm going to show you what the most common MSK transducers are, and then I'll show you a few quick pointers. The first one I'm going to show you is a linear high frequency transducer. This is the one I probably use the most. This one is 18 megahertz. And the next one I'm going to show you is the hockey stick. This is definitely a favorite amongst MSK. Usually it ranges anywhere from 15 to 22 megahertz. And then the last one I use probably most infrequently, usually with the hip, is a curved high frequency transducer, which is usually around 9 to 10 megahertz. And there's definitely a lot more transducers on the market, but these are kind of your three staple transducers. And now I'm just going to show you a few tips to optimize your imaging and kind of reduce the stress on your body. Okay, the first one I'm going to show you is the proper way to hold the linear transducer. In this case, I'm just going to show you a quick example of scanning the distal biceps tendon, and I'm going to show you an incorrect way and then a correct way first. So if you put the transducer down to look at the elbow, an incorrect way would be to hold the transducer near the cord, because with the distal biceps tendon or other structures that have either an oblique course or are very small, you really need to have control of the transducer. So what you want to do is you want to hold it at the base of the transducer near the footprint, and it will give you so much more control, and you can add pressure. And in this case, like when you're scanning the distal biceps tendon, when you want to flex the elbow or like rotate the transducer to like get a more oblique course, you like really have control, and you're just making subtle movements instead of here where you're kind of sliding all over and fumbling around with a bad angle. So I was just holding it here and anchoring your hand on the patient's body. Kind of think of it as the same way when you're like writing with a pencil or a pen, and you like want to like really have control with your hand when you're holding it. This will make you such a better sonographer when imaging structures with a difficult course or that are very small and you need to be very steady with. Next, I'm going to show you an example of the hockey stick. So this one you could really mess up with not holding it correctly. So if you're holding it like this, it would be almost impossible to have control of it. You'll be sliding all over. There's bones you're trying to get around. So same thing, you want to grab the transducer at the base so that you have control. And you can really control the hockey sticks. It's nice and small and really is similar to like when you're writing something. You can go right over the structure of interest, use a lot of gel, and you could just make subtle movements. And one thing I notice I'm always doing is kind of using one of my fingers to steady my hand too. So while I'm scanning, I'm like kind of using one of my fingers almost as like to be able to use a lot of gel and kind of almost create a standoff pad. And then I'm also anchoring the palm of my hand on the patient. So I like gather up my gel for these superficial structures, and then I put my finger down to be off the skin a little bit, and then I'd anchor my hand and hold the transducer at the base. So then you can easily sweep from radial to ulnar or flip the transducer 90 degrees and image it in the short axis from proximal to distal, and like really controlling how much pressure you use. And another thing is you want to make sure that you're comfortable and the patient's comfortable. That will also help. So you just want to like raise up the bed so that it's at your height. And then you can also, in this case, have the patient like drop their elbow so that they're comfortable and can do a long-lasting exam. Okay, the last one I'm going to show you is the curved high frequency probe. This one's 9 to 10 megahertz, and I'm going to show you the hip joint. So with this, you know, lots of times again, I see people holding it like this because they're just you know, accustomed to that, but you should hold the transducer at the base and put your hand on the patient's body to anchor it. In this case, with the hip joint, you need to turn the distal part of the probe a little bit lateral, and you have so much control over it. Like I said, you can just sweep back and forth in the long axis from medial to lateral, and then turn the transducer 90 degrees and sweep in the short axis from proximal to distal. But this technique will give you so much more control, and over time it just becomes like second nature, and you're going to be like healing and towing when you're trying to eliminate anisotropy, and then toggling up and down. And when you're holding the probe correctly like this, it just makes it so easy. Okay, hope that helped.